Again tonight with the Idaho Department of Health and Welfare saying there is a backlog now of reported COVID cases. Just into our newsroom, the department says due to the recent surge in cases, case data over the last 2 weeks is incomplete, with about 11,500 lab results still pending. That backlog limits our local health districts from contact tracing, of course, the process that notifies close contacts that they've been exposed to COVID. It also gathers information about where the virus is spreading. Our Andrew Bartline spoke with 2 public health districts today about their difficulties with this, and this is head-scratching. Andrew?
Yeah, that's right, Mark, and you said it, more COVID cases than these health districts can process. I spoke with Central Health District, located in Boise, and South Central Public Health District out of Twin Falls. Both tell me they don't have enough staff for all these cases coming in, but even if they did, they're also limited by the technology they use. Idaho is amid one of the highest surges of reported COVID cases the state has seen through the pandemic.
We're being overwhelmed with the number of cases being reported.
And that's limiting local health districts and their ability to contact trace.
Which means some people won't be reached for months.
Central District Health in Boise says they're more than 1,500 cases behind.
But it also is harder to pinpoint where somebody may have been exposed and also who they may have exposed.
As cases climb, health districts say they don't have the manpower to process every reported case in real time. And for South Central Public Health District out of Twin Falls, hiring more staff members hasn't been easy.
There is a stigma against public health across much of Idaho, including our district, which makes it so that people don't want to work for public health simply because they don't want to have to face the harassment that public health workers are facing right now.
As cases are reported every day that aren't processed by health districts, the backlog grows over time. All 7 health districts in the state receive reported cases through the same system, and that technology is limited to how many cases it can hold.
What we're facing now is an issue where we can't even download those cases. We don't know where they are. We don't know who they are. There is no way to actually reach out to them, even if we had the manpower to do so, because so many cases are coming in, even the technology is overwhelmed.
Without the ability to contact these people, it limits the health districts from gaining the most up-to-date information about where the virus is spreading in the community. But they have some general ideas.
We're seeing more spread in settings that people are not masked, not distancing, and having that closer contact.
Central District Health says the solution is at the root of the problem by taking the necessary steps to limit the amount of COVID cases in the first place.
Make sure that you're taking precautions before you even know that you're sick, so that you don't have to look back and say, if only I had known, then so-and-so wouldn't be sick. If only I had known, then I would have taken better precautions. I would have taken more steps.
Our local health districts are now asking people who have tested positive to be proactive and self-report. Self-reporting allows the health districts to get the necessary information they need, even with the staffing and technology limitations.